Aloha, good morning. Welcome everyone on this Wednesday. I'm Yunji Denise, joined by Ryan Kalei Suji here on the platform of the Honolulu Star-Advertiser. We, of course, bring you the COVID-19 care conversation. It's an opportunity for us to bring you people in the community that are working either on the medical response, the political response, or the business response to the coronavirus. And today, Ryan, we have a very special guest from Hawaii Pacific Health, which of course is one of our sponsors. And he is going to be giving us firsthand experience, telling us about what it's really like on the front lines.
That's right. We're going to be joined in just a few moments by Dr. Jonathan Paladino, who is an intensivist at Straub Medical Center and is the director of critical care medicine for Hawaii Pacific Health. He's going to be giving us sort of his account of what he has seen while working with some of these COVID patients. You know, we've been doing this show, Yunji, for 3 months plus, and I don't think we've ever had this perspective yet of talking to someone who has actually treated these patients, who is on the front line, so to speak, and sort of helping to lead the charge for some of the hospitals in Hawaii Pacific Health when it comes to this area. So we're really excited to talk to him. We want to know if you have questions for the doctor, please make sure to enter your comments into the comment section of our broadcast and let us know where you're watching from. Again, it's always great to hear from some of our loyal viewers who are tuning in. We have Tracy saying aloha from the island of Kauai, as well as others from around the state. So thank you so much. And we are looking forward to engaging with him in this conversation.
Yeah, and speaking of the neighbor islands, yesterday was a big day. Inter-island travel quarantine lifted. There were, of course, more travelers at the airport, people still getting used to the new procedure. Obviously, a long way off from what normal, passenger loads, but still good to see that there is some activity there, and hopefully that leads to some economic activity, and of course families getting to get reunited, and maybe people who have been putting off trips to the doctor. So many people come here to Oahu, can now re-engage with medical care as well. So good to see that opening up, and it sounds like so far we haven't heard of any big hiccups with that process.
Yeah, and again, they are just saying to be prepared when you head to the airport for those temperature checks, as well as for additional paperwork that needs to be filled out about where you intend to stay. And so we'll see how things unfold, as I think more and more people will travel. This weekend, as they're saying, could be the biggest test when most people are likely to travel. So we'll see how things go there. The other thing that we like to do is we like to start off the day by giving an update with the case count. As of Tuesday, there were 4 new cases reported for a total of 740 positive cases here in the state of Hawaii since COVID was reported. And so we continue to monitor those case numbers as we get those counts on the daily from the State Department of Health.
Yeah, so what is it like to actually treat those patients? Well, joining us now is Dr. Paladino from Straub Medical Center. Thank you so much for being with us this morning. First of all, if you could give us sort of your experience. I know that you work in the ICU. How has your experience been treating patients with COVID, and what are you seeing a few months ago versus now?
Oh, well, thanks for having me. It's been a roller coaster, and it continues to be a roller coaster. I guess probably the best place to start is, we were most likely taking care of COVID patients before we even knew they were COVID patients. We were having in January and February a lot of people that we presumed had the flu, but they would never test positive for the flu. And so, there was already some hints that something was stirring under the water early on. And then as January morphed into February and we started, realizing that this was an actual entity and that we were starting to see it in Hawaii. And there was a complete lack of information. We didn't know, how to care for these people. We didn't know, what risks we would be exposing ourselves to. And I had the misfortune of being one of the first people in the state to actually have to put a known COVID patient on a ventilator. And there was great confusion and anxiety about how to do that safely, not only safely for the patient, but safely for myself as the operator and safely for all the staff that was in the room. And, the fear was palpable. I mean, a lot of times, people are very relaxed and communicative in that environment because it's an everyday occurrence for us. But here, you could hear a pin drop in the room, and everybody was moving with exaggerated slowness and care to make sure that they didn't create an inadvertent aerosol or event. Because, we didn't, we knew that the numbers were rising. We knew that this was a potentially fatal illness, and we were putting ourselves in harm's way, actually testing our oath as medical providers to put the patient's needs first. And, we were actually having to live that and not know, what we were exposing ourselves to. Over time, as more data and information became available, as we streamlined our process, as we gained experience taking care of these patients, the anxiety level has somewhat abated. But even to this day, when we get the call, we have a known COVID patient that's coming in, and we're going to be responsible for taking care of them. There's still that baseline concern that this is just a little bit more than the usual, because we don't have a textbook to go to with definitive proven answers of this is what you do, this is what the risk is. So operating in that kind of vacuum of information is still, like stepping off a cliff into murky water. You don't know how deep it's going to be. You just hope it's deep enough.
Given the absence of medicine and the absence of, clear-cut guidance in terms of what you should do, what are you doing to treat these patients? What are some of the protocols that you're using? Right.
So, again, we saw in the initiation phases of this, multiple different responses. Everybody had their own particular ideas. As data came out about the physiology, about what COVID was doing to people, how the people's immune systems were responding, people were trying different combinations of treatments. And you started to see a lot of protocols coming out. And you had some large organizations, be it like the WHO or the CDC, try to pull all of that data together and try to provide some guidance. But it was very chaotic because the trials were not the same. Even though you may be basing it on the same drug, like a hydroxychloroquine, the way the British healthcare service would run their trial was different than the way that the FDA would run their trial, was different than the way that the French would run their trial. And so you couldn't collate all those numbers together to get a good aggregate response of what to do. So what we chose to do was to kind of chart an aggressive middle path. We didn't want to adopt the latest, greatest, we just saw it on the news last night, approach to healthcare. But what we wanted to do is to stay up to date by texting and communicating with all of our colleagues across the mainland and across the world that are in the critical care pulmonary environment, infectious disease environment, and saying, okay, what's come out for you this week? And then we would try to aggregate that data ourselves and say, does this make sense? And what is the potential risk to the patients of trying this protocol? And then we would start to adapt a very specific protocol for Hawaii. And the way that we particularly approached it here is not necessarily the way they approached it in New York. So, it was very tailored to our patient population. And I like to say it's about the 80th percentile level. We didn't want to be on the bleeding edge trying things that nobody else has tried. We wanted to just be professional, be conservative, but be adaptable and not be willing to get locked into a rigid mindset on how we were going to care for these patients. Because things that we started with early on, have fallen by the wayside. We've learned that they've not been helpful, or perhaps, their side effect profile outweighed their benefits. And so even to this day, we're still, changing our strategies.
Nancy Mitchell has a question from our audience talking about the study indicating steroids that we heard a lot about yesterday. Helpful in those recovery of those on ventilators. Was it surprising to you, she's asking, haven't steroids been used already for acute respiratory diseases in the past? She's curious to get your take on some of these latest findings.
Yeah, no, that's a very good question. I'm not surprised at it at all. Actually, what I'm surprised at is that steroids didn't come up much earlier in the discussion and treatment of coronavirus. Steroids have a very mixed and checkered history within the pulmonary community, especially for, as Nancy mentions, ARDS, or acute respiratory distress syndrome. and even to this day, we've been studying steroids in ARDS for 20 plus years, and the jury is still out on exactly what steroid to use and what dosage to use. Steroids are very potent anti-inflammatory drugs. They kind of turn the immune system down, and that's a very much a mixed bag. When your immune system is supposed to be fighting an infection and you turn it down, you run the risk of allowing that infection to run rampant or gaining a secondary infection. However, specifically with coronavirus, we know that part of the most severe cases are the immune system running out of control. So turning down the immune system would make a lot of sense. So I think I'm not surprised by the study at all. It's actually something that we discussed very early on in the case, do we treat these severe respiratory infections as we would the classic ARDS? And the answer that we adopted back in February was that yes, if they're acting like an ARDS patient, you want to follow the best ARDS data because it at least provides us a model to base our behavior on. So with this new dexamethasone study, it's intriguing. I think it makes a lot of empiric sense. But as almost anybody will tell you, we need more studies, we need more data. And above all, what we need is kind of a global response that, if this is the pilot study, the first people out there that look at dexamethasone, then we need to make sure that the next people that look at it, do it in a similar fashion so that we can have an apples to apples comparison, because everybody doing their own thing really just adds to confusion.
We always like to bring in the audience, of course. Emilio Ganitano says, are we going to see a new surge? And then also following that, the second question he asks is, are your ICUs ready for a possible next surge? So let's take those two questions separately. First of all, we've seen even just this month as opposed to last month, we've had more cases this month already, and we're about halfway there than we had in all of May. Obviously, things have started to open up, but are you expecting a possible next surge, and are the ICUs ready?
So I'll answer it in two parts. Are the ICUs ready? I'm very happy to say that I think that our state response has been robust. This crisis, even though here in Hawaii, we live in such a unique environment where we're always just a couple of days of running out of supplies. If the container ships don't show up at the port of Honolulu, we only have 48 hours worth of, this, that, or the other. And so whether it's coronavirus, whether it's a hurricane, the people in Hawaii have always had to have kind of a baseline awareness that they need to be prepared for these types of disruptions. And coronavirus made us as a healthcare system, the hospitals across the island, really take a hard look at our disaster response plans. And they are in the best shape that they've ever been. We now understand the resources we have, where they come from, what the time lag or turnaround time between a request and an answer is. And we've obviously increased our capacity for taking care of critical care patients. And we've developed a communication between the various healthcare centers. And so we can kind of act in a concerted fashion in this state to take care of everyone. So we're very prepared. Now, being very prepared doesn't mean that our capacity is limitless. The fear is always that we could have that next wave or really that next tsunami that overwhelms the system. But to the limits that we're able to, I think our ability to care for patients now is the best that it's ever been. And I'm very confident that we're starting off in a good position to take care of these patients. Now, the second question is the second wave. Are we in a second wave or not? A lot of that depends on the definition of wave. Epidemiologists have very specific criteria for when you call the beginning of one wave, when you call the ending of the other wave. Dr. Fauci, the head of the CDC, has basically weighed in and said this is not a second wave. But what we're seeing is outbreaks as social distancing requirements loosen up, as states begin to open up, as people begin to move around. as corona fatigue sets in. People are just tired of dealing with life this way, and they just want things to go back to the way they were. We're starting to see, these smoldering embers, burst into flames. Here in Hawaii, we're starting to see cluster outbreaks, multi-generational family homes, nursing homes, these types of things. You're starting to see it flare back to life. That doesn't constitute a second wave. It just means that the first wave was never out. We still have these pockets all throughout the country that we're beginning to see to flare to life. And certain states that were not hit in the initial wave, like Arkansas, like Tennessee, we're starting to see they're now experiencing their first uptick. Whereas other states like New York and Washington State, they're already on their downswing. So trying to look at the United States as one giant pot is going to make things very difficult to understand. You have to look at it community to community. When did the virus first arrive? When did it peak? And then when did it finally recede? And so we're having the additional upticks and outbreaks. We should expect that. The purpose of social distancing was never to eliminate the virus. It was to control its spread and make sure it didn't overwhelm the healthcare capacity to take care of people. And to that end, it's been very successful. We need to continue it and be prepared for these upswings.
I want to go back to, the height for you when you saw maybe the surge or the number of cases increase in your facilities where you were working. What was that experience like? How many patients were you maybe dealing with at one time? And what is it like trying to manage these multiple cases of COVID in that environment? If you can take us back to explaining from your account what that was like.
Right. So the problem or the challenge of COVID is that as healthcare systems, you don't just shut the doors and stop taking care of everything else. People that were going to have a heart attack or that was going to have a stroke or that was going to have a life-threatening stomach bleed, they still had all those things. And we still had to be ready to respond and take care of them. But now you're going to add in the extra layer of now you also have these COVID patients. And where do you put them? How do you take care of everybody? How do you keep them from cross-contaminating each other? How do you protect the patient that came in with a stroke from getting the coronavirus from the patient next door? And those were very significant challenges, both for the physical infrastructure of the hospital, how we handled the air moving through the patient's rooms. It was basically double the number of patients for a period of time. Now, what we saw is that as we stopped doing surgeries, as we stopped doing elective cases, and quite frankly, people were afraid of, they may have had chest pain, but they were too afraid to come to the emergency room to have their heart attack diagnosed. We started to see the usual volume drop off, and then the ICUs become more predominated by COVID. There were a couple of days here at Hawaii Pacific Health where the ICUs were actually operating over 100% capacity, where we had to utilize kind of our Plan B approach to take care of patients. But every patient received the standard of care. They were placed in the environment that was best suited to take care of them. We actually have a 7-step process for how to care for people at Hawaii Pacific Health. We only ever hit step 4 of that process. We never went all the way to step 7, which would have been the true kind of apocalyptic scenario. But by planning it out and knowing what you were going to do ahead of time when resources got stressed, it meant that there was no panic. You just, looked to see where you were, what you had, and what the next steps were going to be. And so, we're very happy to say that, everybody was dealt with. We had no complications. We had no true shortages. Nobody was ever deprived or denied of any care that they should have received. But there's no question that it was stressful to the staff to try to juggle all those plates at once.
I know that given that you work in the ICU, you see the people who are the most severely impacted, but Kuipo Pule has a question this morning. Every positive patient won't need medical intervention, correct? What are you seeing for the people who may not present as sick and may not end up in the ICU? Is it that the majority of people who are infected basically they ride it out, or what are the outcomes that you're seeing?
Yeah, the vast majority of people do not need medical attention. The number of hospitalizations is, I mean, take the state of Hawaii, for instance. We defined 740 positive cases, but only 91 of those ever required hospitalization. And of those 91, only, and here I don't exactly have the number, but only a fraction of those 91 ever required critical care, ICU, mechanical ventilation, those types of interventions. So there you can see if you get it, you're 90% likely to stay out of the hospital and to manage this in your home environment as you would, the bad flu or the bad cold. So she's exactly right. Not everybody is going to require medical intervention.
I also want to get your take on sort of the nursing home facilities. We know that the elderly are, the highest risk for some of these, for getting infected with COVID-19. What are your thoughts on sort of the efforts to protect this vulnerable community, especially moving forward? And what are some of the steps that need to be taken in order to protect them? Because we've seen on the mainland these nursing homes and how they become sort of the epicenter for those communities because they're such at risk. What are your take on how to ensure that these in our community, the kupuna, are protected and safe?
Yeah, no, absolutely. You want to deploy your resources where they're going to be the most effective. For instance, if testing now is all the hot topic. Who gets tested? How many people get tested? Should it be universal testing? I would submit to you that you start with those who are the most vulnerable. And our kupuna, the nursing home populations, these are the people that if they do contract coronavirus are the most likely to have a severe complication or even die from this illness. And so they should be the most stringently protected. They should have the strictest guardrails on them regarding testing on admission, testing on, if they go to the hospital and then have to come back, requiring a clearance process. The nursing homes, in a collaborative and with state guidance need to look at how they institute their own versions of social distancing and how their own staff observe hygiene and protective personal equipment, the PPE, because that's kind of one of the feared scenarios that we've always been worried about is if a corona outbreak, because we saw this in New York. The New York, made some probable mistakes in how they managed their elderly nursing home population, and the results were catastrophic. Thousands of deaths, and so we want to avoid that here. And so these people are the most vulnerable. That's where we should deploy our resources first. And then begin to work our way backwards from there.
You talked about those embers, so to speak, still sort of, and perhaps sparking up. What are you anticipating? Because we are starting to open up. Restaurants are now open. Inter-island travel is open. We're anticipating sometime, perhaps late July at the earliest, but more likely, the governor did say on this program, probably sometime in August, we will welcome trans-Pacific travelers again. Is there sort of a threshold that you think is acceptable? And also, what do we as individuals do? Because you did talk about coronavirus fatigue, and I think a lot of people have that. How do we make sure that we continue to maintain all the practices that we've learned while not getting burned out, so to speak?
Right. I think this is where I'm glad I'm not the governor. You have to balance idealism versus practicality, and as a physician and healthcare provider, I'd love to say, I want everybody locked in their basement for 6 months and never see the sun until this is all over. But then that's not practical. The purpose of social distancing, of all of our policies that have been rolled out so far, has never been to cancel the virus, to eliminate it, to remove the risk. The purpose of all of it was to make sure that the healthcare system, that the hospitals stayed intact, that they could deliver care to everybody who needed it, and that nobody would be denied care, or that care would be rationed, which is things that we saw would happen in places like Bergamo, Italy, one of the worst outbreaks. So we wanted to keep, as I described earlier, people having their normal heart attacks and strokes, and people that have coronavirus. We want to care for everybody to the best of our abilities. So the goal was always to have everybody show up to the hospital at a reasonable rate, and not everybody show up on a Monday. So as we begin to open, what we have to do is just take a very measured week-by-week response, and we should expect the numbers to go up. And we should expect to see these outbreaks flare. But the question is are we on the upswing to reach a level where we're going to start taxing the healthcare system? Summer times traditionally are slower times in the hospitals. We see, entire hospital units and wings kind of close down as the seasonal illnesses die out. And then in the wintertime, we start to see the natural influenzas and these types of things cause the censuses to go up. And so now we have to overlay the coronavirus requirements on that. I would actually say that now in the summertime, we have more capacity to take care of more cases. But if we start to see flare-ups in December and January, then we might find ourselves in exactly the same position we were in this year, wondering how are we going to take care of everybody? So the Department of Health, the CDC, all of our emergency management organizations, unfortunately, they're not going to get much rest for the rest of the year. You're going to have to look at the data day by day and look to see, are we on a trend where we're going to overwhelm the hospitals? And then if that's the case, then you can expect a lot of the loosening up to get tightened again, that we may have to shut down again, that we may have to reinstitute the stay-at-home orders if that's what's necessary to protect the healthcare systems, so that they in turn can protect the people of Hawaii.
Oh, Ryan, we lost you.
I'm sorry. There we go. There Dr. Paladino, thank you so much for just taking the time this morning to be with us and to share those insights. It was great to hear. I think very educational for, I know myself and for many of the viewers of this program to hear that account. So we appreciate you taking time, and we just appreciate all the hard work and hours that you're putting into helping to keep our community safe. So thank you so much for being here with us today.
Noah, thank you so much for the opportunity, and it's my privilege.
All right. Aloha.
Thank you.
Thanks. Bye.
Well, very interesting to hear from him. And, the bottom line is that this is not over, and those embers continue to smolder, and we have to get used to a certain level of virus. The question is, what level taxes the hospitals too much and then forces another shutdown, which of course is what we don't want. So social distancing, wearing your mask, washing your hands, all those things, they're so critical and they're so simple. We do have some fatigue, of course, but we need to keep and stay vigilant.
Yeah, just an interesting account to hear from him firsthand of some of the things that they've experienced on their end. We've heard him, I thought it was interesting to hear about the different levels. He mentioned that they have sort of these 7 levels or steps that they go to, and that they've only had to go to level 4. So that's, in a way, a good sign. But interesting to hear, like I said earlier, we haven't really heard that firsthand account of the things that they've experienced, and really the conflicting messaging and directions of care as, people throughout the country sort of navigate through how do we cure this, and the healthcare professionals continue to have this debate over what is the best practice moving forward, and hearing from his account of how they experience that and how they have to decipher what treatment of care they administer to these patients, as so many people around the world are doing so many different things. So very insightful. Again, if you missed any part of this, you can always go back and watch this on the rebroadcast through the Honolulu Star-Advertiser Facebook page, where we have all of our videos listed. Yeah, like and share this. Make sure that the message gets out, because it is such an important one. One encouraging thing that he did say was that 90% of the people don't need medical intervention. And of those that do need medical intervention, only a small portion end up in his unit in the ICU. So that, of course, is great to hear. But there's so much unknown with this virus that we need to stay vigilant. One of the things that we saw announced yesterday, Honolulu Mayor Kirk Caldwell
adds $25 million to the small business grant program. We know that so many small businesses in Hawaii are suffering. If you are someone who runs a small business and you need financial assistance, you can head to the website that Ryan just put up, oneoahu.org. That's a place where you can apply. And if you're a business that already applied, our understanding is that wherever you are, you kept your line, you kept yourself in the queue. So that's good to hear as well, because Ryan, we know that so many folks are really hurting right now.
Yeah, they're really expanding their services. There was a specific criteria for those businesses that did qualify for this, but they did sort of expand it more based on the need. We will be speaking to the mayor tomorrow to talk more about this application process and these grants, as well as sort of the other things that the city and county of Honolulu are dealing with here as the city begins to reopen. So looking forward to speaking to the mayor about this program. Again, the website was sort of taken down, and it's relaunching again at noon today. So be sure to head back over there. I'm sure they're going to see a lot of traffic there yet again.
Yeah, we always read your comments, and I just noticed this one from Roz. One of the challenges has been the different attitudes of friends and some family regarding level of carefulness and following all the recommendations for avoiding catching the COVID-19 virus. Roz, that is so true, and we would love to hear from you about what those interactions are like. Are you having to ask people to wear a mask? How do you feel? I know that personally, I was in the elevator the other day and someone got on the elevator, which is fine, but they weren't wearing a mask, and I did feel kind of uncomfortable, but then I also didn't feel comfortable enough to say, would you please wear a mask? Ryan, I don't know how you handle things like that.
You know, and I think in Hawaii, it's also difficult when we're so used to greeting each other with a kiss on the cheek and a hug. And so it's sort of been a difficult thing to navigate through. You don't really know the comfortable level of the person that you're talking with. And so I think there's different levels of what people are comfortable doing. And it's creating a social dynamic that I think it sometimes can be a bit awkward, but I think it's going to become the reality for many of us as we sort of navigate through how do we interact with each other, as well as try to find ways to protect one another, be it through masks or other social distancing mechanisms, as we sort of get to see each other again for the first time.
Yeah. And the Star-Advertiser's big question today, how do you feel about mask wearing against the coronavirus? Leading the poll there, it's of course informal, it's on their website. Wear masks indoors and outdoors. So most of you are answering that you are wearing those masks. And then the outdoor question is a whole other layer. As you walk down the street, do you always wear a mask? If you're running, do you wear a mask? All of these things we're trying to figure out. But of course, the main point is that we're trying to take care of our community and keep those embers out. Another way we care for our community is, of course, through food. And there's something amazing happening in Hilo right now, Ryan.
That's right. We always like to highlight our Hawaii hero of the day. And this one is the Asami's Kitchen in Hilo. You know, this is a kitchen for many people, a local spot that many Hilo residents are aware of. And for the past 3 months, Asami's Kitchen has been preparing over 125 meals every Saturday for the keiki in the Hilo community who live in those low-income housing and are not able to make it to the meal distribution sites during the week. The gang at Asami's has been preparing these meals with the Burnaby Ohana, who has stepped up to help deliver these meals to these families. And it's just so great to see that the Hilo community coming together. There have also been other companies that have stepped up to help. Sui-san has made donations of canned drinks, as well as others have donated cookies and snacks, as well as face masks. But really leading the chart has been the Asami's Kitchen over there in Hilo. And you know, we're hearing so many stories just like this of businesses coming together. But this one is coming from my hometown in Hilo. I loved Asami's. They used to be at the Prince Kio Plaza. I worked at the mall. I would go there every time to get shoyu chicken for lunch break. If you're from Hilo, you know how great their food is. And so great to see that, though, they're continuing to find ways to help support our keiki and those who are less fortunate by providing this service. So thank you to them, our Hawaii hero of the day.
Yeah, and if you've got a nomination, tell us. We'd love to highlight people who are doing good in your community. We also want to remind you, of course, that tomorrow Mayor Kirk Caldwell is going to be on here. Linda has a question. Are cops exempt from wearing masks? We're going to ask him. We'll ask him about the protocols that city workers are taking and how he feels about the restaurants reopening. We saw him out on a bike. That's something that's happening on Sundays now from 6 to noon. Kalakaua Avenue closes to cars and people have been out riding bikes. And he was out there. I saw him wearing a mask and riding his bike on Instagram. I actually was not out there myself, but, but good to see, how they're kind of adapting and trying to bring some business into Waikiki. So we'll ask him about all of that. And then on Friday, Senator Brian Schatz is going to be here. As we continue to talk about budgets, we've got a lot of questions for him about if there will be any subsequent PPP programs, if there's more CARES Act money coming, or if this is sort of it, and also get his thoughts on how to open travel in Hawaii.
That's why we talked to Paul Yonamine yesterday, and he says, from his account on the financial standpoint and just looking at what some people are dealing with, he's really worried about the fall and some of these people really taking a hit in their budgets once all these sort of assistance programs from the government run out. So it'll be interesting to hear from Senator Schatz and some of the developments of what is happening in Washington, D.C. to sort of help and continue the support, because we know that the country as a whole is not done with this as we continue to see cases rise. So we are looking forward to that conversation with him as well. And then right back again here next week, we have the governor lined up, as well as a few other guests. Lieutenant Governor Josh Green also scheduled to come back here on our program. So we are excited again to continue this conversation and thank all of you for tuning in. We, of course, want to mahalo our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for continuing their support of this programming to allow this conversation to happen. And again, encourage all of you, for more information, head over to the Honolulu Star-Advertiser for updates on the latest COVID-19 pandemic here in Hawaii. Until tomorrow, we will bid you an ahui ho and to stay safe. Aloha.
Aloha.